Welcome to Friday's report out. Delighted that we've got two important report outs today. We're going to start with Alison and Kathleen on Learning Disabilities and Autism Care Bag pilot, which I'm really pleased that we're reporting out on this today, because I can remember coming along to the launch and seeing the actually the contents of the bag. So really interested, guys, in how it's going. So whenever you're ready.
So, hello, and thank you for that introduction. And yes, it was lovely to have you down at the launch event. So I'm Kathleen. I'm the Quality Improvement Clinician for the Learning Disabilities and Autism team. We've done something a bit different for the report out today. We've done a little video that kind of just shows what the project is and how it's going. So we're midway through our 6-month pilot. So we thought we'd just come back and tell you how it's getting on. So can we play the video, please?
From idea to fruition, our service users have been at the heart of this project. We had a successful launch day with team engagement from the patient to the board. In the first 2 weeks, we trained 292 staff members across all the specialities that work in the emergency department. We have given out over 90 care bags. With the tagging system, we have tracked around 70% of the bags. The Learning Disabilities and Autism team have added new appropriate alerts to the electronic patient records of over 50 patients. They have made contact with and supported the completion of health passports with every appropriate patient. The Learning Disabilities and Autism team have been able to support 12 inpatients they might not have otherwise been notified about. In the 3 months before the care bags were established, we received 7 PALS complaints from patients with a learning disability or autism diagnosis when they were attending the emergency department. Since the bags have been established, we have received no complaints at all. And in fact, we have received 98% positive feedback from both staff and patients regarding the care bags.
Whoever thought of putting together the care bag I received during my visit to A&E yesterday, you are my hero right now. It made such a huge difference. I've just got back from 10 hours in A&E at St James's, which was really tough. However, this made it a million times better. An autism care bag, oh my God, this is seriously amazing and helped so much. It contained ear defenders, which blocked out the beeping, the voices and the unpleasant sounds of other poorly people. An eye mask, which helped so much. It blocked out the vicious light and put me into the calming, soothing dark so I could rest, breathe through the pain and get some sleep. A stress ball, a popper and a chew ring. I held on to the stress ball for the whole 10 hours. The variety of things in the bag meant that there was something that worked for me. A colouring book, not a kid's one, or one with just blanks to colour, but with pieces of art to copy, with suggestions of colour matching and techniques to try. Beautifully detailed for my detailed, focused brain, and not patronising, but something that was very needed, a very needed escape and distraction. Easy read information and booklets. In shutdown or overwhelming or pain, these were so much more accessible for me. There was image-based information which helped. The bag itself, the fabric and smooth label. The label was so soothing to touch. So what were the effects of this for me? I could rest. I felt loads calmer. The instant I put the eye mask on really helped. My migraines didn't get triggered by stress. I did not melt down or shout. I didn't get triggered to throw up when hearing others doing this. I was occupied for periods of time so my husband could rest a bit more than usual. I still had a big crying, can't cope episode, but at about 9 hours in, when I'd finally got seen, I could speak. I wasn't so exhausted or traumatised or overwhelmed that I was non-verbal. I could describe what was happening, I could respond to questions, and I could say what I needed. I could stay in the department long enough to get seen and treated. I could instead of couldn't, which is huge progress. So thank you, St James's Hospital, whoever thought of doing this. You are my hero right now. There are follow-up effects too. I now at home want to finish colouring the rabbit image, and that is very pleasant for me. A positive, a motivation, an interest that I am bringing home in the midst of the pain and tiredness. Something that is not a memory of trauma, so my memory of my A&E visit is not one that will now cause me to feel terror if I have to go again. A definite light in the dark, a tiny piece of lightness that is enough to keep me going.
The next step for the project is to secure ongoing funding. This is being applied for by Leeds Hospital Charities, and this will mean that we can roll the project out to all acute admitting areas. We also want to start co-managing the project with our Get Me Better champions. As we said from the start, this project has had our service users at its heart.
So we thought the best people to tell you how the project is going are the people that have been using it. So that was very focused on some patient feedback, really. But yeah, any questions? Happy to talk about any of it and all of it because we're very proud of it.
Fantastic. Thank you, Kathleen. Alison, that was, what a great video. I'm blown away by the impact and the feedback. Listening to that testimony was fantastic, and
we may have cried quite a lot when we got it.
Yeah, but just illustrated and you must have found great validation from the feedback on all the items and the overall effect, because I know a lot of thought and care went into that. And the other thing that struck me was the way it gives us that impact in terms of understanding and tracking those patients in the hospital if admitted, yeah. And also the impact on complaints as well. So really good work, guys.
I was just going to say longer term, and we haven't been able to capture that data in just the 3 months we've been doing it, but we want to look at, has it had an effect on readmission rates? Because we thought that was really important what was said in that feedback, that actually she could stay in the department long enough to get seen and treated. She didn't leave, bounce back, which our patients do, really. So we want to be able to see if that's reflected in the longer term data of attendance figures. But at the moment, the data just looks great. I mean, the PALS thing, to go from 7 in 3 months to none since we've established. Yeah, I was hoping that the PALS stuff would show a reduction. I wasn't quite expecting to go to nothing. And especially in a time we know A&E is so pressured at the minute.
So pressured. No, absolutely. There may well be more questions for you at the end of the report out, as we generally take questions at the end, but that's been great. Alison, Kathleen, thank you for sharing that, and great work. Please come back to another report out in due course on how it's going. So I'm going to move us on now to the second key report out item, and I'm delighted that we've got trauma and related service value stream 60-day report out for the RPIW. Now I can see on screen, Amanda, are you kicking us off?
Katie's going to start, but I'm here with Jonathan as well.
Oh, that's great. Hi, Jonathan, Amanda, and Katie, over to you.
Yeah.
Yeah. Hello, my name is Katie Tankard, Ward Manager of L34 and Process Owner of the TRS RPIW Week, which focused on improving patient pathway following surgery for a fractured neck of femur. We focused on day one of the patient's journey where certain criteria needs to be met, so we came up with an ideal timeline of a patient's day. This was 6 AM for observations and catheter removal to be done, 8 AM oral morph to be given and sitting up in the cardiac chair position, 9 AM to be seen by physios and a clinical support worker, where in addition to a normal physio session, patients are also weighed, washed and a 4AT completed. The non-time definite tasks included review by the surgical team, ortho-geriatrician review and day one bloods. Other areas of patient care we looked at was patient nutrition, which is being monitored via the ward metrics, and creating parking spaces for observation machines, which is a 5S metric that is being monitored as part of the implementation. The aim of the RPIW week was to improve patient journey and reduce wasted time. During the 30-day report, which we did, the CSW and physio sessions had been embedded into practice. However, the weighing of the patients in the sessions had not become ingrained within the sessions. So our focus between 30 and 60-day report out was to ensure that this was being completed. There has also been some issues with delivery of parking spaces for the observation machines, which has led to this not being fully ingrained yet. This is something we're continuing to chase, and we actually received delivery of this morning, so will be completed between the 60 and 90-day report. Next slide, please.
Hello, my name is Jonathan Slack. I'm the Ward Manager of L35 and Joint Process Owner for the RPIW. Having a look at the actions, as Katie said, we've just taken delivery of the parking space stickers, so they'll be set up this next week. We've worked really hard on improving weights by redistributing the RPIW week reports. We've discussed this at the Perfect Ward meetings. We've ensured that the RPIW boards were visible to staff and patients alike, and working closely with the physiotherapists and ward staff to remind them of the importance and need of the weights during the joint collaborative session. We are aiming to facilitate a formalised training on the 4AT delirium screening questionnaire so that more staff feel confident to complete this for their patients. In addition to improving lead time within the RPIW, we are hoping that it will improve all patients' care who may experience delirium whilst under the care of trauma-related services.
Next slide, please. Hi, my name is Amanda Walker. I'm the Ward Manager on L9 and also a process owner. As you can see by the table, the baseline at the beginning was 55 hours and the target by the sponsor was 16 hours. In the Rapid Improvement Week, we managed to get it down to 7 hours and 46 minutes. And at day 30, I was a little bit upset that it had risen to 51 minutes. Albeit when we got it down to 7 hours and 46 minutes, it was the people working in the Rapid Improvement Week, so there weren't clinical staff on the ward, so they weren't taken away from their tasks. However, at day 60, we've managed to get it down to 9 hours and 31 minutes, and that's from what we found at day 30 about the people and patients not getting weighed. So we was able to improve that, which we're really proud of. Next slide, please. So what went well? On all the 3 wards, we found that the physios and CSWs are working integrated together, and it's now ingrained as part of the culture on the TNO wards. For example, if a CSW moves from L9 to 34 or 35, they know like the process, the standard process and what to do in terms of getting the patient up day one post-op and doing all of the 8 steps to complete all of the care within the time frame for the patient. We're going to continue this work and work alongside the wards again together. And we've got the visual boards on the ward, which are good for all patients and staff and relatives. And we get questions from the relatives about the boards, and they're able to see what their next of kin is able to do day one post-op. And the work between the 3 wards continues to be improved and standardised. We're really proud of the work that we've done, and we're excited to continue the work, and we will be able to report out on day 90 on the 5th of August. And that's it from us.
I am. Thank you for that. Thank you. I was just saying that's great. Really good. It's great to see way I was really struck by what you were describing in terms of from sort of 6 a.m. onwards, the different timing inputs of the different components. Really impressive, and also the way that the multidisciplinary team is coming together to work. So great report out after 60 days, guys. Thank you. So let's get into questions, and let's open it up. So we've heard from obviously all about the learning disability and autism bag and all the success and improvement that's having together with the great work the TRS team are doing on fracture neck edema and the benefits patients are seeing as a consequence. So let's open it up for questions and comments. Janice.
Thank you. Thank you to both groups. Fantastic work. Really, really great. I'd like to ask the T&O group, please, if I may. Really great to hear the way about the blended working that you've got working there, and that's we know that is an approach we're wanting to encourage across all of our areas. Have you also did the physiotherapy service as part of this look at their improved efficiencies because of the joint working with the support worker and the rest of the ward teams?
Yeah, so we've been working quite closely with the Band 7 physio, Natalie Bell, and she is kind of gathering, but most of the feedback that we've been getting from them has been more kind of how they found the experience, because we worked out that although the session lasts longer, because it's only using one physio staff member and one CSW, actually the overall timings hasn't improved, but actually all the feedback that we're getting about the team working better together has been really positive. So we will be looking at that for the 90-day just to see if we have any kind of numbers to compare. But at the moment, we have just used kind of feedback from patients and staff that have been involved to kind of see how that's been going.
Smashing. Thanks very much. And it's just that's a really, I'm sure there's an efficiency there for the physiotherapy resources in that by working together with the ward team in a better way. Well done. Great piece of work. Thanks.
Thank you.
Great. Thank you. Thanks, Janice. I'm looking for other questions. Phil?
Thanks, Julian, and thanks again to both teams. Fantastic presentation. So I kind of got one question for each of you with wonderful work that's clearly had patient benefit. So are there lessons we can think about for all of our kind of range of neurodiverse patients in terms of the work you've done? So that would be my first question. Are there things we can think about for other patient groups that this work gives us a real sort of direction on?
Yes, definitely. I think there's a wider reach for the bags. We've already been talking to Ali Raycroft, who heads up dementia care, our safeguarding colleagues. I'll be honest, the issue that the stumbling block we've come across is the funding streams, and if we're going through hospital charities and looking for external charities to fund, they'll probably be learning disability specific or autism specific. But we're definitely in touch with all of them, and want to look at whether we can broaden.
Yeah, okay. Now that's really good, because I think dementia patients, recovering patients, there are lots of opportunities, aren't there, for this kind of work, and if it's got that value, because it's really interesting that it potentially prevented the lady's example. It kept coming back to it. So there are some cost benefits to us as an organisation from doing it, which I guess is quite helpful. So thank you for that. And then I guess it's a similar question, I suppose, for the T&O team in terms of that kind of pre-mobilisation work. Do you think what do you think we could think about for other groups of patients from that? How easy do you think it would be to translate some of what you've reported to us today into other groups?
So we were just discussing it as a free. while Kathleen was talking, thank you. And we just said actually a high percentage of our patients do suffer with dementia because they come in and they've broke the hip, but a lot of them do have dementia. And we found that obviously they've already met the CSWs in some circumstances before they've gone to theatre. So then in the morning when the CSW and the physio meet up together, they're already familiar with somebody. And previously, before this work, well, ordinarily, the CSW would, on day one post-op, would go to the patient and would give them a bed bath. And then the physio would see them later in the day. But we're kind of setting a precedent that actually, prior to coming to hospital, you were fit and able to walk, because sometimes we know with these patients, we do like kind of stop them from doing their norm. So when we're setting the precedent on day one that you can get them out of bed, sitting them in the chair, then obviously you are probably over a longer period of time than what we can measure now, like reduced length of stay in hospital. So getting people out of hospital back home sooner, decreasing risk of harms, and then obviously helping our colleagues in A&E by reducing wait times in ED. So we already do have a high percentage of dementia on all 3 of our wards. So we think we are already doing that as part of this work. And I'm sure it would work as well in other specialities.
Yeah, thank you. That's really, really great. Thank you.
Fantastic. Thank you. Thank you very much. Just checking for any other questions. Jimmy.
Just comment from me. Part of this workshop for the TRS work, although I'm delighted to see the positive impact, and yeah, the patient story there really brings it home about the great work there. So congratulations to those clever folk whose idea it was and have made that happen. So acknowledge that firstly, and then to the TRS colleagues, I do know how much work you put into trying to line this up and connect people in that space. So just really pleased to see, despite some really tricky times ongoing, that the team was stuck with this. I've spoke to all of you a couple of weeks back, I think it was, and it's not, you portray it to be working well, but I know that you're working on some of the challenges that come up. So it's just to acknowledge that really the volume of work you guys have to do is massive. So to support the team to help this stick at 60 days and that lead time, definitely something to be proud of. So yeah, well done, and look forward to seeing the 90-day numbers. I'm not sure you can beat that one, but I'd be great if you can sustain it and just build on that in terms of that reliability of the process across your wards. Because for those who aren't aware, that was one of the things that these guys worked really hard to connect as well. It doesn't matter where you arrive in our organisation now with a fractured neck or femur, you're going to get the same high quality care. These focus areas are still there. So I'm just going to take a minute there to reinforce that great work and encourage you to stick with it. Well done.
Great. That's a great, I think that's a great note on which to close, Jimmy. Can I just say to both groups, both report outs, very different in their own way in terms of the areas and the sort of the focus, but very, very similar in the underlying focus on being patient-centered and the level of collaboration that's gone on to create this, and both using the Leeds improvement method, which illustrates to me, because that's one of the reasons I always love report outs, is we see different parts of the organisation serving different groups of patients, but using the same consistent approaches, which are making such a difference. And in both examples, it's great to see the direct impact this is having on our patients and on the quality of care improving, and great to hear the feedback and see the impact. So well done, all of you. Great report out, really inspiring for a Friday after an incredibly busy week. Thank you very much for joining. And we'll see you all next time at our next report out, Friday the 5th of August, 12:30 p.m. Thanks very much, everyone. See you next time.